Next question comes from one of the stars of the hit HBO comedy series, Curb Your Enthusiasm.
Hi, doctors. Cheryl Hines here. I'm up in the mountains in Aspen, and I'm wondering, how do you prevent altitude sickness? And if you do get it, what do you do? Need to know.
Well, as you guys know, I used to work up in conditions of high altitude above 9,000 feet. But first of all, Dr. Orton, you love to ski. Jim, you love to ski. What do you guys do?
You actually have done studies and written papers on this subject, and I know you're an expert. But the key there is prepare yourself. You know, get yourself in shape. If you're not used to altitude, when you go, give yourself a couple days of rest before you start physical activity. Is one thing you can do. Make sure that you're hydrated.
You want to make sure you're hydrated when you arrive at altitude. There are some prescription medications that you can take a day or two before you go to altitude that may help prevent some of the symptoms. But there's really only one treatment once you start developing severe symptoms of altitude sickness. So there's just altitude sickness where you have flu-like symptoms, the headache. But there's also high altitude pulmonary edema where you develop fluid in your lungs, can become life-threatening. And there's also high altitude cerebral edema, which too much fluid buildup on the brain. I've seen all of these things happen. If you're developing confusion, difficulty breathing, that's when you have to go ASAP to the emergency department. The only treatment is oxygen or descending to a lower altitude. The other key thing here is I hear a lot of people say, well, I don't do well at altitude. It absolutely does make a difference how high up you are. So one of the ERs I used to practice in was at 9,500 feet.
That's up there.
That's up there. And people would come out and I'd say, look, they would suffer from high altitude pulmonary edema. I would say, look, next time you go on a ski trip, go to a resort at a little bit lower altitude. There are plenty where it's 6,000, 6,500 feet. You're not going to have that same intensity of symptoms. So if you know you suffer from altitude illness, talk with your doc before you go, and you may be able to prevent it from happening in the first place.
You know, our ski trip that we did 2 years ago now to Breckenridge, I'd never been to Breckenridge. You know Breckenridge well, and you warned me that you're at 9,000 feet, and at the top where we 13,000 feet. So I prepared for it. And something that I heard about, I started on caraway seeds.
Oh, right. You gave some.
And it worked.
I remember that,
And it worked. But some other remedies you may want to try. Garlic. Why garlic? It releases hydrogen sulfide. What that does, vasodilator, it's going to help open up circulation, potentially open up the airway in your lungs as well. And mint.